Welcome to the Family Care Office's webinar on doula and midwifery services. My name is Carla Murphy. I'm a certified birth and postpartum doula and childbirth educator with 8 years of experience helping expectant and new parents. In this webinar, I will talk about what midwives and doulas do, how doctors and midwives work together if necessary, how to find a midwife and a doula, what you should consider when choosing which midwives and doulas to interview, and some of the questions you might want to ask during that interview. I will be mentioning websites and other contact information as I go along, which can be found on the script provided with this webinar. You can also contact the Family Care Office for help finding resources. Often people aren't sure what the differences are between midwives and doulas, but they have very different roles in caring for expectant and new parents. A midwife is a licensed healthcare professional with a Bachelor of Science in Midwifery. She is registered with the College of Midwives of Ontario, which ensures she meets education and practice standards set out by the government. Midwifery care is covered by OHIP and UHIP. Midwives provide complete care from pregnancy to 6 weeks after birth for you and your baby. You will have a team of up to 4 midwives who are responsible for your care. 2 of these midwives will most likely be at your birth. Prenatal appointments with a midwife are generally longer than those with a doctor, and midwives provide more comprehensive care after your birth than physicians. Like a doctor, a midwife can order tests during your pregnancy, such as blood work and ultrasounds, and monitor the general well-being of you and your baby. Midwives can perform most of the same tasks during pregnancy and birth as a doctor, with the exception of a C-section, which must be done by an obstetrician. Generally, most women receive all of their pregnancy, birth, and postpartum care with their midwife. However, if complications arise at any point in your care, they will refer you to an obstetrician. Depending on the situation, they may then continue your care themselves, work in tandem with a doctor, or transfer your care. Midwives are able to attend births at home, in a birth center where they are available, and in a hospital. Your midwife will assess your health needs and provide information to ensure you make a safe and informed decision about where to have your baby. Your midwife will also visit you at home several times in the first week or so after your baby is born, and then will see you several more times before you are discharged from her care at 6 weeks postpartum. She will carry out well baby checks on your newborn, in addition to ensuring you are recovering as expected. If there are any health concerns with your baby, she will refer you to a pediatrician or your general practitioner. A doula, on the other hand, is a person who provides non-clinical support and care to a woman and her partner if she has one during pregnancy, childbirth, and the postpartum period. Women have complex needs during childbirth. In addition to the safety of modern obstetrical care and the love and companionship provided by their partners or other support people, women need consistent, continuous reassurance, comfort, encouragement, and respect. They need individualized care based on their circumstances and preferences. To this end, a doula works with a woman and her family, physicians, midwives, and nurses with the goal of enhancing communication and understanding. With a doula present, the pressure on the partner or other support person is also decreased, allowing them to participate at their optimum comfort level and increasing their enjoyment of the birth of the baby. Ideally, the doula and the other support person make the perfect team for the woman, complementing each other's strengths. The vast majority of doulas have extensive training in pregnancy and childbirth, with a focus on supporting you in the choices that you make. Many doulas also have training in offering breastfeeding support. And while doulas are not licensed, many do belong to professional organizations, and almost all will actively engage in professional development through training courses and conferences. A doula cannot provide medical services or advice. She can, however, help you find reliable information from creditable sources that will help you in making decisions about your pregnancy, birth choices, and the care of your baby. She will also provide you with extensive information on comfort measures during labor. A doula charges you directly for her services, with fees depending on the type of care you want and your location. Some insurance companies will reimburse you for doula fees, so be sure to check with your provider if you have private insurance. In general, both midwives and doulas believe that pregnancy and birth are natural processes for which a woman's body is ideally designed. They tend to take a more holistic, less medically focused view of this important time in a woman's life. They usually consider the entire person, including their partner or other support people. The emotional and psychological impact of pregnancy, birth, and postpartum are addressed during appointments as well. This more natural focus does not mean, however, that midwives and doulas are not supportive of whatever choices a woman makes during her pregnancy, birth, and postpartum. For example, both will fully support a woman's decision to have an epidural or to formula feed. Having a midwife does not limit your pain relief options to the non-medical if you choose to have a birth in a birth center or the hospital. Some birth centers and hospitals provide nitrous oxide, commonly known as laughing gas. Laboring in and possibly birthing in water is also a possibility at many birth centers and some hospitals. Spending time in water during labor and birth has been shown in numerous studies to help improve a woman's comfort level during labor and birth. Women who birth at the hospital will also have access to pain relief methods such as narcotics and epidurals, depending on their personal circumstances. Having a midwife does not mean that you cannot use these options, nor does using these options mean that your midwife is no longer responsible for your care. As always, it is best to discuss all of your options and the benefits and risks with your care provider before making any decisions. Once you decide that you would like to use a midwife for your pregnancy and birth, there are a couple of ways to go about finding one. On the website for the Association of Ontario Midwives, there is a Find a Midwife tab on the left-hand side of the page. You can search through their directory, which allows you to enter the practice name, the midwive's name, your location, or your hospital of choice. You can also search by map. Each listing tells you where the clinic is located, the area they serve, the midwives working at the clinic, and which hospitals they attend births. You can also simply Google Midwives Toronto and get a list of all midwifery practices in the city. Another good way to find a midwife is to ask friends, family members, colleagues, and classmates who are pregnant or who recently had a baby for their recommendation. Your family physician may also have information on midwifery clinics in your area. Word of mouth is also a great way to find a doula. Aside from family, friends, and colleagues, be sure to ask your healthcare provider if they can recommend a doula or doulas. Check at community centers, fitness studios, maternity or breastfeeding shops, and where you take your prenatal classes for brochures and pamphlets from individual doulas. Most doulas will also have a website where they explain their philosophy of care, offer information on their rates, what areas they work in, and more. You can get some ideas simply by Googling Toronto Doula. Another good resource is the Association of Ontario Doulas. Their website has a Find a Doula feature that allows you to search for a doula by area, name, and type of practice. For example, if you want a doula who provides birth support, you can search only for birth support. If you want one who provides only postpartum support, you can search simply under postpartum. Many doulas do provide both types of services. When you've completed your initial research and you're reviewing the list of doulas and midwives you wish to interview, you might want to keep these things in mind. Midwives are in extremely high demand in Toronto and the surrounding areas, so you may be limited in your options based on availability. If you think you would like to have a midwife as your primary caregiver, you should contact midwifery clinics serving your area as soon as possible in your pregnancy to arrange an interview. And while there are a lot of doulas working in the GTA, you may also find that your preferred doula has been booked if you wait until too late in your pregnancy. It is highly unlikely that you would not be able to find a doula to support you, even on short notice, but your choices will be limited if you wait until close to your due date. Some other things to consider. What area does the midwife or doula cover? Midwives generally have a defined practice areas, and doulas will vary with how far they are willing to travel. Where is the midwifery located? Close to your home? Close to work or school? You will be visiting once a month for the majority of your pregnancy, and then more often in the last couple of months, so you want to find a location that is convenient for you and your support person. If you think you would like to have your baby at a hospital, you also need to check where the midwife and her colleagues have privileges. Is it at the hospital of your choice? And is that hospital close to home, work, or school? You may not be able to tell much about a midwife from her clinic's website, but you will often be able to gather a lot of information about a doula from her website. Does her philosophy of care fit your preferences? Are her fees within your budget? Does she offer discounts or volunteer services for students or low-income clients? You can also call a doula and chat on the phone to get a sense of whether or not you feel she would be a good fit for you and your support person before you set up a face-to-face meeting. Once you've decided which doulas and midwives you would like to interview, it's a good idea to prepare a list of questions in advance so you can get the same information from each person that you meet with. Many women like to take notes during the interview to help them keep track of what is said and their impressions of each prospective midwife and doula. Some of the questions you can ask either type of caregiver include: how long have you been a midwife or a doula? How would you describe your philosophy of birth? What will happen if you aren't available during my labor? And can I contact you between visits if I have a question or concern? For a doula, specific questions might include: what type of training do you have? What are your fees? And what is included in those fees? Do you have packages that combine birth and postpartum care? And how many clients do you support per month? For a birth doula, how many prenatal visits do you provide? And when do you come to me during labor? For a postpartum doula, you can ask: how do you schedule visits? What can I expect you to do during a typical postpartum visit? And you can ask both types of doula: do you have a backup? And can I meet her? And also, can you provide references? For a midwife, you may want to ask: how much time do you allow for each prenatal visit? How many midwives in your clinic will be involved in my care? And can I meet with them all before the birth? With either type of practitioner, you should always feel comfortable bringing up any issue or concern that you may have, asking for clarification of an answer or for evidence to support their practices. Ultimately, many women say they choose their midwife or doula simply because they felt like they clicked with the person during the interview process. Thank you for listening to our webinar, and if you have any questions about accessing care or support services for pregnancy, birth, postpartum, and beyond, please contact the Family Care Office at 416-978-0951, and again, reference our script for contact information for the various websites and associations. Thank you.